Let's see if I know.
Okay, most people have had a relationship with someone who has been diagnosed with breast cancer. Whether it's a friend, co-worker, relative, or neighbor, it has affected us all in some way. Breast cancer is the most common cancer among American women, and is the second leading cause of cancer deaths, exceeded only by lung cancer. Breast cancer affects both men and women. The American Cancer Society predicts that about 230,480 new cases of breast cancer will be diagnosed in women, and about 39,520 women will die from breast cancer this year in the United States. Each year, it is estimated that approximately 1,700 men will be diagnosed with breast cancer and 450 will die. These numbers continue to increase. It is very important that both males and females do regular self-breast exams monthly. Most lumps are not cancerous, but if you notice any changes in color, shape, or discharge, you need to go to the doctor immediately. The earlier the breast cancer is detected, the better your chances are of beating it. According to WebMD, it is more difficult to diagnose women under the age of 40 because the breast tissue is generally denser than the breast tissue in older women. This is why it is not recommended that women under the age of 40 get regular mammograms. According to Dr. Edith P. Mitchell, African American women are more likely to develop aggressive tumors. She recommends that we wait no longer than a month to follow up with a physician. It is critical that we act fast when something is detected. Once breast cancer has been diagnosed, doctors perform other tests to determine the stage. The stage is determined by measuring the size of the cancer and where it is spread throughout the body. There are 4 stages of breast cancer. They are ranked from 0 to 4, 0 being early and 4 being the latest. In stage 4 breast cancer, the disease has spread to other organs such as liver, lungs, and the brain. There are many treatments for breast cancer that include surgery, chemotherapy, radiation therapy, and hormone therapy. The treatment prescribed by the doctor will be determined by the age of the patient and the size of the tumor. There are very many preventative measures that we can take to prevent cancer. Healthy eating is the #1 key to good health. Dr. Oz states that there are 5 foods we need to have in our kitchen regularly. Nutritional yeast to replace cheese. It's high in protein and fiber. Freeze-dried tomatoes have 10 times the antioxidants than regular strawberries. Did I say tomatoes? Strawberries. Rhubarb, escarole, and banana ice cream, which you can make with just frozen bananas, vanilla extract, and water. Cancer is a very serious disease that can be removed when detected early. By doing breast self-exams and eating nutritious foods, you can save your life. There are more than 2 million survivors of breast cancer in the United States. The later you wait, the worse your chances are of surviving. Here I'm showing you the different stages of breast cancer. This is stage 0. Stage 0 is where the cells have not spread. It identifies a woman as having an increased risk of developing breast cancer. Stage 1, the cancer is no larger than 2 centimeters and has not spread. In stage 2, there can be 2 circumstances. The cancer is less than 2 centimeters, but it's possible that the cancer has not spread, but it's also possible that it can spread up to 3 underarm lymph nodes. In stage 3, there's 2 stages, stage A and stage B. In both stages, the tumor is larger than 2 centimeters, but less than 5. In case A, it spreaded up to 9 underarm lymph nodes. In case B, the cancer is spread to tissues near the breast, including the skin, chest wall, ribs, muscles, or lymph nodes. And then in stage 4, the cancer has spread to other organs such as liver, lungs, skeletal system or brain, or lymph nodes near the collarbone. And this is just the example, I guess. Stop the video.